In this segment, I'm going to demonstrate a muscle energy technique using a post-isometric relaxation effect for an occipitoatlantal articular dysfunction, in which the occipitoatlantal articulation is extended, side bent left, rotated right. With an extended side bent left, rotated right dysfunction, we will have flexion, side bending right, rotation left barrier. So what we try to do is, as we go through this diagnostic maneuvering for occipitoatlantal dysfunctions, we will then find our barriers. So in this case, what we're going to have is a flexion barrier. So I can bring one hand under his head and just move him into his flexion barrier, and then take him into his side bending right barrier, and then his rotation left barrier, and hold him right at that barrier once we find that, any way you feel comfortable doing that. Because it's a post-isometric relaxation technique and his major barrier is flexion, I'm going to take my two fingers and I'm going to place it on top of his chin, just below his lower lip. And in this position, I can start adding a downward force of his chin towards his chest into that flexion barrier. Because with a post-isometric relaxation technique, the physician goes into the restriction, PIR. And now, in a second, I'm going to have a switch to a side view so you can see this a little bit better. Now, with this side or lateral view for this occipitoatlantal articular problem that was extended side bent left, rotated right, I have now placed the patient into his flexion barrier. And now I'm going to ask this patient to bring his chin up into my two fingers here and try to look backwards with your head gently. And he tries to lift up, and I restrict this equally. 3, 2, 1, and relax. And after he relaxes, see if you can pick up an increased movement through that flexion barrier, and do it again. And you can have him contract 1001, 1002, 1003, and relax if you like that way of doing it to get your seconds correct. And one more time. And you'll repeat these 3 to 5 second contractions 3 to 5 times usually, and relax. And if you keep feeling that the barriers improve, not just flexion, but you may have some slight side bending rotation effects to reposition, you can take those as they come. Now, let's say our patient had the same dysfunction, but had a temporomandibular joint problem. So he had a problem here, the left or right temporomandibular joint. What I could do is take my hand on the top of his forehead like this, and then use that with my bottom hand, working in conjunction, bring him into that flexion barrier, and then ask him to pull his head back and look back up to me with his head. So lift up and look back and resist that. 3, 2, 1, relax, and then pick him up into his new flexion freedom and break through those flexion barriers, and do that 3 to 5 times. And relax. Good. And then you would go back to your original position, and then with your intersegmental motion testing, check your occipitoatlantal motion the way you originally did to determine that dysfunction was there initially.